Can you tell me about atopic diseases or atopic comorbidities?
Atopic, and what does that really mean when we attach it to the word eczema? So atopy is actually a very, I think it's Greek or Latin, but it means out of place in the universe. And it really means that you're hypersensitive to what would normally be well tolerated in your environment through the skin. And that it's associated with a kind of hyperreactivity or hypersensitivity to other environmental triggers at other linings of surfaces on your body. So the interior linings of your lungs, so asthma, and the lining of your nose and airway for hay fever. You can have problems with seasonal allergies that goes very often is associated with eczema, and that the lining of your eyes. And so all of this is what we consider to be an atopic group of diseases. So asthma, food allergies, allergic rhinitis, allergic conjunctivitis, and eczema. We also know that apart from those atopic associations of eczema, that there are other what we consider comorbidities or very common coexisting issues. We know that atopic dermatitis can have such a significant impact on your ability to sleep at night that often comes with an impact on what you can do during the day. There's so much unpredictability to the disease and so much burden of that torture and itch that it can very often be associated with anxiety, even depression, and in many cases, a hyperactivity or an ADHD. And you can imagine that very easily when you think about just how often you are thinking about the itch, that it can impair your ability to work, your ability to go about your normal day-to-day life.